Yeah, so today is day 7 of my shoulder post-op. I'm not sure if I posted yesterday was day 7 or today was day 7, but today is officially day 7. Tomorrow's day 8. The stitches should be coming out tomorrow, and we're gonna do it ourselves because my doctor is back in New York, so it shouldn't be too hard to pull out the stitches. So wish me luck on that one. Other than that, I'm part of a group called, I believe it's something like, I'm going to post it down below. Let me just double check. It's shoulder surgery related group, and I've been pulling up a lot of these tenodesis procedures, and I noticed there's like so many mixed opinions and experiences that it's quite frankly concerning. I don't know what to expect. Everywhere I look, I'm looking for the Pitt method for my procedure, which is what my doctor chose. So that way, I have a higher success chance for it not, first of all, not breaking, because it holds a great deal of load, this procedure. And a break would mean a Popeye deformity. So that would look really bad for me. So we don't want it to break. And the other issue would be, like besides its braking, it's very stiff, and you lose a lot of range of motion depending on the anchoring procedure. So in my case, they don't anchor; they're doing soft tissue to soft tissue, which is basically they do a stitch method and they loop it around shoulder ligament. So I definitely don't feel like I lost any kind of range of motion. Um, I hate to say my shoulder feels almost fine, except for pain I get in any kind of movement away from my body. So if I'm moving my arm off to the side, it definitely is very unpleasant. In the morning, it was fine. I took pain medication at 2 a.m. And this is day 7, because I went through a couple of days where I really didn't feel anything. And I stopped taking it, and maybe I got too cocky because I got back on the elliptical. I did 30 minutes and I moved a lot. Maybe I should have chosen like stationary bike, easier stuff. But you always want to jump a little ahead. So it's probably letting me know that I've pushed it a bit these last couple of days, because the pain towards the evening really gets up there. I have to work, so I spent time on the computer doing as much as I could with left hand. Where I needed to, I would interject with both hands on my laptop. Either way, when I'm sitting and working, my hand has to be in this kind of bent 90-degree position, and it's still uncomfortable to sit like that for hours and still straining the shoulder. And I'm guessing it's just, it's been 3 days of being pretty active, being back home, trying to get moving quicker and getting back to speed faster. Obviously, that's probably taking a toll. So today I really started feeling a lot of pain at about 3 or 4 p.m. maybe. And then I realized I didn't take pain medicine since 2 a.m. last night. And, I'm obviously using it all day. And I got to remember, I'm just 7 days post-op. So that's so far. Today I didn't train. I took time off of training. Tomorrow I'm just probably gonna do stationary bike just to still keep moving and get the blood flowing, and hopefully it won't mean as much issue with the shoulder pain towards the night, because I am running low on the strong pain medication and I don't like it. So I wonder when it'll all resolve. As far as pain, I'm reading different things, but it doesn't seem like many people have my procedure. So I don't know what to expect. I see things all over the board. Like, people basically get out of pain very quickly, and some people stay in pain for a very long time and have probably some very hard experiences. I'm seeing all sorts of things like open shoulder tenodesis, and people that say that they're in pain. It's been like months and they're still in pain. So yeah, that's so concerning. And when you read that kind of stuff, and going into a surgery like this, it's always something that's in the back of your mind. You want to pick that right professional to do your work, because It's pretty serious. There are a lot of risks that come with surgery, and a lot of things can potentially go wrong, not only in the healing process, but in the time to come afterwards. So you got to really tread carefully, especially in the first weeks of recovery after surgery. It's really a crucial point in time. Luckily, my cleanup was fairly general. It was fairly straightforward. It wasn't as invasive as some people needed to have, because some people really tear up their shoulders pretty bad. Mine was pretty tore up, but it wasn't like what some people end up, where they have a mix of things like a torn, usually like when there's a torn labrum, there's also going to be, other cleanup work that they have to do, which is repairing the rotary cuff, which, like I mentioned in the previous video, can be very, very invasive. And, in my case, luckily, I didn't have the rotary repair, because once they're repairing tendons, that's definitely a much longer recovery time. You're definitely looking at a year worth of recovery solid before you're doing anything very demanding. And that will always come with like a labrum repair, and then like probably a tenodesis, depending on the age of the patient. Usually once somebody gets to be my age, they no longer do labrum repairs. Like I mentioned, they do just the tenodesis. But sometimes, depending on the case, they can be doing many things inside the shoulder. It's like getting the works. They'll do the rotary and the labrum and the tenodesis, depending on the doctor and everything, and different procedures, and the outcomes vary greatly. So it's so important to look and see and research. And honestly, there isn't enough information out there on this. So I'm putting this out there, and I'm hoping that this helps somebody's journey at some point when they were in my position, looking at this method, and maybe want to know more about what it does and how exactly somebody recovered from it. If you reach out to me, I can always let you know how I recovered if you're not watching it pretty recently. And hopefully it's really great news. And of course, I'm always happy to refer my surgeon. He worked on my 2 ACL surgeries, which are coming along. One was an old one, and one was fairly recent, actually. But anyway, that's all for now. Day 7, tomorrow stitches out. Hopefully getting a little bit more time with the cardio, just more on the bike versus doing a lot of movements with the whole body. And stretching. Gotta start stretching. And tomorrow's Tuesday. Wednesday I'm back. Yeah, tomorrow I'm in PT, and Wednesday I'm going back to PT again. So that's where I'm at. All right, over and out.